Hello friends, welcome to my channel Breathwell Lung Care because every lung and every breath matters. From today onwards, I am going to start a very short lecture series on must know classical signs in thoracic radiology so that you will be able to identify the important thoracic radiological signs which helps in the diagnosis. In today's lecture, I am going to discuss a very important and interesting sign called as the air crescent sign. So in today's lecture, I am going to discuss what is air crescent sign, how it looks like, how to identify air crescent sign radiologically on chest X-ray as well as on CT scan, and what are the different conditions in which the air crescent sign is present. So let us start with the today's lecture. Air crescent sign. So air crescent sign appears as a crescent of air surrounding a soft tissue mass in a pulmonary cavity, and it can be seen in both chest X-ray as well as on the CT scan. Though it is a characteristic of the invasive pulmonary aspergillosis, it can also be seen in the various other conditions like cavitating neoplasms, lung abscesses, and various other infections also. This sign is considered a good marker of the immune activity as it is seen when the necrotic tissue gets invaded by the leukocyte and replaced by the air in invasive pulmonary aspergillosis. There are few other conditions in which the air crescent sign can be seen. These conditions are pulmonary gangrene, pulmonary hematoma, Rasmussen's aneurysm in tubercular cavity, and lung hydatid. Air crescent sign mimics the monad sign with few differences which is seen in the patient with the aspergilloma in a pulmonary cavity. So about the monad sign we will be discuss in the next lecture. So let us discuss with few examples. So this is an axial CT scan of a 40-year-old male presented with the 2 weeks history of the fever and was diagnosed with the invasive aspergillosis. So in this axial CT scan, it shows the cavity in the left lung with the soft tissue mass within it and a crescent of air which is shown here with the white arrow around it representing a radiological sign which is called as the air crescent sign. So here is the cavity. In that cavity a soft tissue mass is present which is surrounded by the rim of air. So this sign is called as the air crescent sign. So let us discuss with another example. This is a chest X-ray PA view and an axial CT scan of a 65-year-old male presented with a 3 weeks history of the fever and a cough and was diagnosed with the invasive aspergillosis. The chest X-ray and CT scan of this patient shows the cavity in the right lung with a soft tissue mass within it and a crescent of air surrounding the mass which is shown here with the white arrow representing the radiological sign which is called as the air crescent sign. So here is the cavity which is present here. Here is the cavity which is present here, which is filled with the soft tissue mass surrounded by the rim of or crescent of air, which is called as the air crescent sign. So, in the summary, what we have discussed today, we have discussed air crescent sign is a crescent of air surrounding a soft tissue mass in a pulmonary cavity. It can be seen in both the chest X-ray as well as on CT scan. Though it is a characteristic of the pulmonary aspergillosis, it can also be seen in various other conditions. We have already discussed what are those conditions in which air crescent sign is present. This sign is considered as a good marker of the immune activity and it mimics a monad sign with few differences. So this is all about the air crescent sign. I hope you all understand what is the air crescent sign and you all will be able to identify the air crescent sign radiologically on chest X-ray as well as on CT scan. In the next lecture, I will be back with the one more very interesting and important sign called as the monad sign along with the few differences between the air crescent sign and monad sign. Till then, bye bye. Thank you so much. Like and share this video and subscribe to my channel.